Navigating the health and social care system can feel challenging at the best of times. If you're in a mental health crisis, this challenge is considerably amplified. If you're a non-mental health professional trying to support this group of people, the work can feel really daunting. So we've made a series of films of 4 different mental health crises. Each of the films takes the patient from the home to the emergency department to demonstrate the clinical pathway. They are not meant to be perfect pathways or perfect interactions. They are designed to create food for thought about what it might be like to be the patient or the carer. The films are about 20 minutes long and have been designed to be used in a variety of settings, from the classroom to the individual learner in front of a computer. We've posed a number of questions and issues to help you think about the case, which means the session will take about 90 minutes.
Everyone knows about cancer, you know. You talk about someone with dementia, no one knows anything about dementia basically. You know, not even a nurse, unless they're trained, or even a doctor, unless he's trained. Knows nothing at all about dementia.
What are you doing, dear? What?
Insects on the
Don't worry about that. Sort that out later. Come on, I'll put the kettle on. Let's go and have a nice cup of tea, eh?
It's in my head.
Oh, no, it's all right. A nice cup of tea sorted out. It's been ages. It's been over an hour.
There's nothing that we can...
No, don't worry. I'm going to give them another 5 minutes and then I'm going to call them again. Oh, dear. Poor boy. Come on. It's all right, dear. Don't worry. Don't worry. They just come to see if they can help you. Hello, James.
Hello, James. My name's Tim, and this is Rachel. Sorry you've had to wait. We're here to help you.
Just take me to the garden.
Quite possibly, yes. I'm going to have a conversation, if you don't mind, with Ruby. Find out what's going on.
I'm working on a pond feature.
What's happened today?
Well, he's just got really agitated over the last couple of days. He's been diagnosed with the early stages of dementia and he's aware of that. But just the last couple of days his condition has completely deteriorated. He's just gone downhill rapidly. He's very confused.
Okay. James, could Rachel do some observations on you and your blood pressure and your temperature? Would that be okay?
Can you take me to the garden?
Yeah, that's fine.
Just like Rachel.
When we called the ambulance and the crew eventually arrived, they were very quick. And one of the ambulance crew was really good with me. He explained everything really well. But the other chap, although he was very nice, he just, when he first came in and sat down, he said, "Okay, my dear, what do you expect us to do whilst we're here?" And that really confused me because I thought, well, you called an ambulance. They should be looking at me and knowing what they should be doing. I shouldn't be telling them what I expect them to do.
James,
so have you noticed anything different with James in his behaviour other than this being agitated?
Very confused.
Yes.
He doesn't. He's imagining things. He's seeing things that just aren't there.
Has he been eating well?
Oh, not really. No, I've got food ready, and he's just sat there. And
So he's nibbling. He's nibbling.
Bit,
and how
yes.
about drinking? Has he been drinking plenty of fluids?
Yes, I think so. He'll take a drink and then forget he's got it. You know. But,
and what about his waterworks? Has he been regular?
well, I think so. I mean, seems to have gone to the bathroom a few times, but then he gets up and walks around for no apparent reason anyway.
There's no reason why you would know, but have you noticed when he goes to the toilet whether his urine has been smelly and dark at all?
I haven't really noticed.
Okay,
no, sorry.
okay.
Yeah.
Anything else? Does he have any other medical background? Has he been to hospital in the last 10 odd years?
Oh no. He's been really well. I mean, as I say, we've only been going backwards and forwards to the doctors in the last sort of 18 months, I suppose, more regularly because of the dementia.
Right.
He just started to forget things and.
But his baseline blood pressure and things like that at the doctor, that's been fine as far as you know?
No, the doctor's not shown any, he's not sort of said there's anything particularly unusual about it.
Okay.
Yeah.
How are we doing on the obs, Rachel?
James, you've got a bit of a temperature at the moment. It's 38.5. He's tachy at 115 and his rests are up at 24.
Okay. That very much tells us that he's got a bit of an infection going on.
Oh.
Given his background, I think we probably want to pop him down to hospital.
Really?
Yeah.
Oh.
Yeah, how's that going to go down with James?
It'll probably be okay. If
Yeah.
I can come, can't I?
Of course you can,
Yeah.
of course you can. James, I think you've got a bit of an infection and we'd like to pop you down to see the doctors at hospital. Would that be all right with you?
To go in the garden.
Yes,
Yeah.
we're going to go out. We have to get your
Yeah.
coat.
So what?
No, it's all right, Daddy.
All right, don't worry, James. It's all right. We'll explain everything to you.
You've got a beautiful garden out your back, haven't you?
No.
Did you do that all yourself?
Yes.
Did you?
It's a pond future.
Is it? Did you build that?
You did.
Yes.
You did. That's what he did. That was your work, wasn't it?
Really? That's
Thanks so
fantastic. Can you come and do mine?
He'd love to, I'm sure. But it just needs to get a bit stronger.
How are you feeling, James, at the moment?
I need to pee, I think.
Do you?
Oh, dear.
Have you got pain in your tummy?
It's
No, it's all right.
It's okay.
All right, it's all right.
heavy.
Have we got any problems with his bladder at all, Ruby?
Well, I was just saying to Tim, I mean, he has been to the bathroom maybe a few more times, but then he's been so agitated, he's just been walking around anyway.
But there were insects crawling on the floor.
This is unusual, is it, for the insects and things like that?
Yes.
Has he had any change in his medications at all?
No,
None at
just,
all. Okay,
no
okay.
change.
Has he had any paracetamol today?
No.
What about in the last 24 hours?
I gave him, he had something yesterday because he said, it seemed as though he had a pain somewhere, so I just gave him.
Okay, how good is he with tablets?
He's quite good.
Okay,
yeah, he's quite good.
Well, we'll pop a couple of paracetamol. That'll help the temperature.
Oh, yes, of course.
Okay.
Yeah.
What we need to do is get a chair. We'll take
Right.
James out in our chair. We'll explain it all to him.
Okay.
And pop him in the ambulance, take him down to the hospital.
Okay.
Okay.
So should I get the coats?
We'll be fine. If you, in due course, if you can grab a coat, we need minimal stuff. We've
Okay.
got a blanket we'll wrap him up in,
Alright,
so be
okay.
nice and warm on the way out.
Okay. Okay. All right. Thank you.
I need a coat in the garden.
Yes, we're going to go out. Tim's going to take us out and to go and see the doctor at the hospital. All right. It'll be fine. It'll be fine. I'm coming with you. All right. Yes.
Get the coat.
Yeah. And.
It's okay, my love.
So, Ruby, what we're going to do now is pop James in our chair. Would it be possible for you to go and get a bag for him for hospital? Nothing tremendous.
Just a
And
few
his
bits.
medication that we take with him.
My coat in the
I'll look after James, okay? If you want to do that, and we'll pop him in the chair now.
It'll be
Is
all
that
right.
all right?
Get my coat.
Okay. Thank you.
Come on, James. Right, we've got our chair here, James. All right, let me talk to you about it. It's a funny old chair. It's not got any arms in it. I'm going to help you into the chair, okay? Don't be worried about it. All right? You trust me on this one, okay? So I tell you what. Treat me like a frame, okay? So if you hold on to my elbows here, all right, and just stand up for me. That's right. And just come round with me, shuffle round. Keep looking at me. All right, now, that's it. Trust me on this one. That's it. Just sit down there.
James.
That's it. Well done. Let's pop your arms across your chest.
Going to the garden, I need a hat.
We'll get your hat. It's not a problem. We'll get a coat for you as well. Okay? Just pop your arms there. We're just going to pop a little blanket round you. Okay.
All right. It's okay, Jim. Just a bit cold out there
That's
today.
it. Yeah.
That's what I want, a coat.
That's it. You get the blanket round you. And I need to put the strap on just to keep the blanket in place. Okay? Lovely. And there's another one down the bottom here. Just pop your feet backwards for me a little bit. That's it. And the other one. Fantastic. And let's pop that up. Okay. So we'll pop you out to the ambulance now. Just relax for me.
Oh. Okay. Sorry, James. Okay.
Little bump, James.
When I was taken to A&E, it was extremely busy because it was a bank holiday weekend and everyone was dashing here and there. But the nurses in particular were really good. They allowed me to take my own Parkinson's medication, and they also knew I had dementia, and they said if there's anything I didn't understand or needed help with, to call them and ask them, and that was a really positive thing for me.
Where's Ruby?
Ruby's just here. Just here.
I'm
here. I'm here.
Come in. Ruby.
Hi there. My name's Ed. I'm one of the nurses, okay? We're just going to get you across, all right?
Hello, I'm Matt. I'm one of the A&E doctors. Can I help with the transfer?
Yes, please, doctor.
Okay.
Why am I?
Right, James, we're just going to get you across onto the other bed. You just lie there, take it cool, all right?
All right, okay. Anyone not ready? Ready, brace, slide. Okay, James?
So I can take the handover.
This is James, he's 70. He's a 3-day history of increased confusion with hallucinations, polyuria, urine dark and quite odorous. Previous medical history of diagnosed dementia on one drug only, donezopryl. His observations on arrival were resps of 24, pulse of 115 regular, a BP of 98/60, a BM of 8, temperature of 38.1, GCS of 14.446. With us, he's had 1 gram of paracetamol IV and a bolus of 250 ml of saline IV.
Okay, thank you. So Mr. and Mrs. Seymour?
Yes, that's right.
Hello there, my name's Matthew. I'm one of the A&E doctors. How would you like me to call you, sir?
What the hell am I doing?
James, his name is James.
It's James. Okay, James. Let's just catch up briefly. How are you feeling?
I should not be here.
Okay, and what do you mean?
There was a man last night. There was a man in the room, and he said I should not be here.
No. It's been like this for the past 2 days. He was diagnosed with the early stages of dementia about 2 years ago, and he's been fine. He's been able to do things and potter around, be in the garden and remember things.
The garden is fine.
I know the garden's beautiful, but the last 2 days he's got so agitated and just pacing around the house and talking.
I could go home if I was at home.
No, you can't go home at the moment. We've got to get this sorted out.
There's nothing that can be done.
So let me just explain. James, I can see you're very worried at the moment, but you're in the right place. We think you've got a little infection going on. And for that reason, we've given you some antibiotics. We've started you on some fluids through the vein. We've started some oxygen as well. In fact, let me just adjust this for you.
Careful.
So it's really important that we get the oxygen going.
He's so angry. He's
the man in my room.
There was nobody in the room.
I should not be there. And now I don't know where I am.
There was nobody in the room. There was just me and you in the house. There wasn't.
No. James, do you mind if I ask, do you know where we are at the moment?
I want to go home now.
Okay.
Wherever I
understand that, sir, but try and answer the question. If you had to guess, where do you think you are at the moment?
I don't.
Right. That's fine. I'm concerned you're a little bit muddled at the moment, James. So I think we need to treat this infection. I think it'll make you feel better. But in the meantime, I think we're going to need to get somebody else to come and help with the situation.
Matt, we need you in by 1. Okay, I'll take over.
Okay. This is Ed. He's one of our nurses.
Hi.
He's going to look after you for now. But I'll be back soon, and we'll continue as we are for now. All right?
Thank you. Thank you.
Hello, James. Hello there, I'm Ed.
Doctors don't always appreciate how slow my thought processes are, and they ask me questions that I can't immediately answer. Also, they talk in medical jargon a lot, and it would be so much nicer if they could have told me what was wrong with me in English, in ordinary, normal, everyday language would have been really good.
How are you feeling? Not so good at all.
My head.
I know. Oh, goodness. James, you know you've got a urine infection at the moment, and that can make you feel really weird and really unwell, and it can do really funny things to your brain. It can make you really confused about things, and it can even mean that you see things or hear things that are not there.
He won't understand, I don't think. He really won't. Oh.
So for you, Ruby, as much as anything else, it's a temporary state. It will get better. So you'll get back to how you were before.
He's so aggressive and restless.
Oh, goodness. And for you, that must have been difficult.
Oh, it's awful. He's just pacing around. Yeah. Last night he was in such a state last night. Thought people were in the house and
Goodness, how frightening for you, James.
Doctors always seem to be in a rush when they come to the bed, and that in itself is a little bit off-putting, and then they talk in this jargon I can't understand, and I feel pressured to give an answer, but I'm still trying to process what the question was, so I found myself nodding in response when I think maybe I shouldn't have been.
James, do you know where you are right now?
No.
So you're in a hospital because you're having some treatment with antibiotics for your urine infection. And one of the really important things that we need to do is to keep reminding him where he is, why he's here. Yes. Yeah. So James, you're in hospital. And one of the things we'll do as well, which is quite helpful, is make sure you can see a clock and that you have a newspaper in front of you so you know what day of the week it is and you can keep up to date with what's going on. The other thing that really helps is bringing in photographs, so anything to make things familiar. So bringing in photographs of family, that sort of thing. Okay. And we've got this fabulous document from the Alzheimer's Society called This Is Me. And if you see, you're supposed to put a photograph on the front here. That's meant to be a photograph of you on the front, so we'll get one. You can get one of those. And then inside, there's questions about who you are, what you did for a living, what you like to eat and drink.
I work in the garden.
You work in the garden. We could definitely put that on. And so when nurses that you've never met before,
making a pond.
Are you?
Yes.
Is that pond going to have fish in it, or what?
Oh yes, yes.
What kind of fish go in ponds? I'm not a gardener, so I don't know.
Oh, some nice big goldfish.
Oh, fantastic. This with you.
He said I shouldn't be here.
Who's that? Who said that? Is this the man from last night?
Yes.
Goodness. I wonder if this man might be also a part of this infection, because sometimes your mind can play some tricks on you when you're not very well. And I wonder whether that man is actually not real. It could be, and it could be you find that man just completely goes away when you've had some antibiotics.
If I was in charge of training staff, I'd like to listen to people, get their points of view across, I think.
Care, compassion, love, and being looked after.